Proper tensioning of small diameter wires on circular fixator frames is simple when using the IMEX Dyna Tensioner. The Dyna Tensioner is a semi-calibrated wire tensioning device. 3 rings on the tensioner body indicate tension levels for 66 mm, 84 mm, and 118 mm full rings. Most surgeons prefer to tension partial rings less than full rings, but the process remains the same. Please note that these lines represent maximum tension, and the surgeon should feel free to stop tensioning before the maximum tension is reached. It is important that the wire tensioner's locking bolt be toward the tip of the tensioner when ready to tension wires. Before tensioning, verify that the wire fixation bolt holding the fixed end of the wire to the ring is secure. The wire must not slip in the fixation bolt or tension will not be achieved. It is also important to use 2-wrench technique to tighten the bolt and nut. If a single wrench is used to tighten the wire fixation bolt, the wire may be bent at the wire bolt junction. This bending can result in displacement of the bone or wire damage. With the fixed end of the wire secured, verify that the end to be tensioned is not locked into position. Open the wire locking bolt and pass the wire to be tensioned into the tip of the tensioning device. Push the tensioning device onto the ring surface and then use a single wrench to tighten the wire locking bolt onto the wire. Holding the wire tensioner body in one hand, turn the larger butt cap clockwise to tension the wire. Increased tension should be felt with every turn of the butt cap. If tension does not increase rapidly or consistently, either the wire locking bolt is loose or the wire is loose on the opposite side of the ring. As wire tension increases, the butt cap will move forward on the tensioner body. Wire tension for the 84 mm ring shown was determined to be adequate just before the second ring was reached. At this level of tensioning, the axis of the tensioner wants to ride up due to the wire tension involved. It is important to keep the tensioner in line with the wire in order not to increase or decrease tension inadvertently. Once both ends of the wire fixation bolt are secure, rotate the tensioner butt cap counterclockwise to remove any residual tension in the device. Then use a 10 mm wrench to loosen the wire fixation bolt and remove the wire tensioner from the wire.